Hello friends, today we have a distinguished faculty with us, Dr. Manoj Arora, Principal Consultant and Head, Nephrology Department and Kidney Transplant Medicine, Max Shalimar Bagh. Sir, can you please share with us when does a patient require dialysis or a kidney transplant?
Right. Very valid question. Any patient of any age, when develops a permanent renal failure due to any of the reasons, then he will be needing some way to live their life and to maintain the function of kidneys. So those are the patients, either they have to be on permanent dialysis, around twice a week or thrice a week dialysis, or they can opt for a peritoneal dialysis, which is done through the at home. And third thing is they can opt for a kidney transplant. So definitely there are many studies to prove, many times it has been proven that the longevity of a patient definitely is much better and is increased after renal transplant. Second important is the quality of life. The quality of life parameters not only include the physical but the mental state also. So if we go by the quality of life index, that also have been proven that definitely the kidney transplant patients, they have a much better quality of life in comparison to the patients who remains on hemodialysis or peritoneal dialysis. So these are the patients without notifying any age, they have to be on, they can go for a renal transplant once their kidney fails permanently.
Yes. And how safe is that kidney transplant, sir?
Yes, kidney transplant is one of the successful renal transplant in our country and all over the world. So over the years, last 20-30 years, much progress has been made and the success rate has increased because of the much knowledge, wider aspect and the wider availability of the more drugs to fight with rejections also. So that is why right now we say that definitely 90 to 95% success rate is there if we go for renal transplant, especially the living donor. Similarly, hardly any 5% difference is there for the cadaveric transplant, but the success rate is also very good for the cadaveric transplant as well. So definitely it is very safe procedure because one kidney is transplanted from the donor in the recipient and it starts making urine and automatically the kidney function starts happening and there is a decreasing of urea creatinine. Patient remains only for 8 days and then he goes back home. So it's a comparatively safer procedure. So safety is good.
How is the quality of life after the kidney transplant?
Right. If we go that initial few days, the patient has to restrict some activities, but he has to remain at home to prevent the infections, to avoid infections and avoid public places. Otherwise, I think the quality of life is as good as a normal human being. Okay. Well, except for taking the medical treatment, whatever medicine he is taking, he is absolutely normal life. After 3 months, we allow them to go for any work with some precautions, like avoiding overcrowding and having proper hygienic methods. Now everywhere wear masks after the corona. So this everybody has learned that mask is good. Earlier we used to tell only the transplant patients that wear the mask, it will be good for you. And they used to feel that it's a stigma. Why should we wear the mask when the other is not wearing it? It seems that something is there. But in this era now, with COVID, everybody has learned that mask is for everybody's protection, not for the transplant. Right. So this is an act over now they are free of this stigma. And otherwise also, they can travel anywhere, they can have good life, they can have good reproductive life, even for the females. It has been seen that they can have the children, for the males also, they can have their families, they can have normal life. So which is, I think, not as good as if they remain on the dialysis. So definitely the quality of life is much better on transplant.
That's really wonderful to know that, sir. So it raises a natural question that who can donate the kidneys?
Right. Kidney donation can be done by any living person, which is a related person. And somewhere there are laws where there can be unrelated person can also donate the kidneys. But in our country, only the related person donates. And second important is the cadaveric renal transplant, where any person with a brain death but beating heart or a non-beating heart, there are criteria. The kidneys can be taken from them and then they can be transplanted in any of the kidney failure patients. So in our country, we go for the related kidney transplant where any first degree relative, your own family member, your spouse, your children, if they are above 18 years of age, your parents, they can give. Or a second degree relatives who are next to your first degree, they can also donate if they are genetically linked, if they are very much related to you. So they all can donate. And second important question I like is what they should be fit enough. Right. So the donors, they are first evaluated whether they are fit to donate or not. Right. once we find them that they are absolutely fit to donate, then only we take the kidneys. So definitely.
So absolutely fit means if a diabetic or a hypertensive patient can also
they don't come into the ideal donors.
Okay.
Yes, the guidelines are being posed as with the age, with pre-diabetic,
okay.
with the diabetes, whether to take or not, hypertensive. We have started taking kidneys of the hypertensive patients also, old age patients also, but they're not the ideal donors, right? So we evaluate the individual patient and then we fit into that whether they can donate or not.
Wonderful. And how is the donor health after the kidney donation?
Okay. Yes, many times the donors have apprehension what will happen to them, how is their health. So first and foremost, then when they have been evaluated that they are fit to donate by the medically all tests, only then we take the kidney. One kidney is enough to maintain the GFR and to maintain their whole life. It has been seen that after 4th or 5th day, we usually send them home, ask for the normal routine activities except for lifting the heavy weights for next 2-3 months. After that, they can do that also, right? So they have absolutely normal life. But yes, regular checkup is very important, which they should not forget. That yes, they should check their BP, they should get their KMT done, they should have to be on regular monitoring by the nephrologist. Right, so that follow-up should not be missed. That is very important, right? So,
and how much time it will take for the recovery of the patients, the donor?
Once the transplant has been done, the next day onwards we start them asking for having some liquids, some diet, and then within the 7-8 days, then he goes home, and he goes home by walking, right, with all the drain as well as the catheter they removed. And we ask them to remain in a good environment for a couple of days, maybe 2-3 months, but have a normal life. He can eat as much as a normal person eats, but it has to be hygienic, it has to be good quality, so that he does not require any infection. The home rest is that because initially the medicines are very in a good quantity, so he should avoid the infections. That is why. Otherwise, he absolutely lives a normal life after transplant.
And the donors?
Donor goes home on the 5th day and takes all activities except for heavy weight lifting. So he eats absolutely normal diet which a normal person is eating. So that is why there is nothing extra thing which we ask the donor to except for heavy weight lifting. That's it.
So these are the precautions a patient should take
for recovery,
for
just
the
for
recovery.
some time.
Any other precautions after the transplant?
Yes, we usually advise the donor that do not take any harmful drugs, maybe a painkiller and over-the-counter drugs. Whenever they have infection or something, they must contact us, or rather involve us. Whatever medication or antibiotic they are taking, they should not be harming the kidneys, and because they are now with one kidney. Similarly, they develop some hypertension. The patient was hypertensive, so BP should be controlled. Right. So these are the precautions which any patient with a one kidney should take, whether it's a donor or whether it's a genetically having one kidney. They both should take the same precautions. Now, next for the patient also, this applies that he has one kidney and his life has changed. So he also cannot have the harmful drugs, over-the-counter medications of painkiller or anything, antibiotics. So nephrologists should be involved and should be informed rather before taking any drugs or anything develop in their health. That should be there.
Right. And if there are any preconditions for going for a kidney transplant, sir?
I think there should not be active infection, there should not be active malignancy, any cancer, and he should be requiring dialysis. That it has been proved that he is needing the permanent dialysis. There is a permanent kidney failure. There should not be any, by chance, there should not be any something recoverable. If some patient develop acute on CKD, but some recoverable factor was there, we treat them and he is off dialysis. So if that is not a criteria, then definitely, if he is needing permanent dialysis, only then he should go for a renal transplant. Then we should talk about preemptive renal transplant. Preemptive renal transplant is that the kidney is failing, but he is not requiring dialysis, but he has reached end-stage renal disease. Okay. Diabetic or maybe some other diseases where the cause can be anything. So preemptive is that without dialysis, he wants that I want to go for a renal transplant. I want to have good life without dialysis.
Right.
So that is also a very good thing.
Right.
Once we evaluate that there is nothing is a recoverable thing, or there is no reversible factor, and he is now has reached ESRD, end-stage renal disease, so he should opt for preemptive renal transplant. Dialysis vintage is one thing, means how much time he has spent on dialysis. Has been proven that more the dialysis vintage, there is more chance of rejection, because he needs sometimes blood transfusion, sometimes infections, there is more inflammation in the body. So it has been seen that if the dialysis vintage is less than 6 months, the results are better. Similarly, if he has not required any dialysis and he wants to go for preemptive, the results are good. So that is also one option for the patients.
That's very useful information, sir. So, if there's any way of stopping that post-transplant complications, sir?
See, post-transplant complications most commonly are the infections, and second important is rejection. So, the balance is required to maintain immunity. If immunity is high, rejection will occur. If immunity is low, infection will occur. So, this balance varies from patient to patient. One patient will not behave like other will not behave like other. Though the body seems to be same, medicines are same, but the dosing is very important. Maintaining their target levels are very important. Regular follow-up is very important. What happens once a transplant is done? The patient becomes slightly relaxed as the time passes. Initially, is very much careful. He will follow your all thing. After 3 months, then after 1 year, he start forgetting that he is a transplant patient because he lives a very good life, and then he start moving like there is no precaution required. But definitely, he has to be protected against all diseases. How? Because once he is in contact with a flu patient or maybe a cough cold, he'll develop pneumonia. He has to be careful with the mask, maintaining distance, so which all are following. So these are, and personal hygiene. UTI is very, very common. So the contributing factor found to be that either he was not keeping hygiene, or maybe not drinking enough water, or maybe ignoring his symptom. That's why they'll end up in more severe infections. Right? So these are the small things which if he follows. Personal hygiene, environmental hygiene. In a nutshell, we say, or in a layman language, if he understands, we can reduce the chance of infection. Overdosing definitely will lead to more infections. So the dose titration, he has to be in regular follow-up. The doctor is responsible for it to maintain the right dosing. It will prevent the infections. And to prevent rejections, definitely medicines. Compliance with the medicine. In a young population, studies have been done in a, you can say from puberty to 18 or 23, 24 years. They sometimes are more non-compliant with the treatment. That is why they have more rejection episodes, because they want sometimes the cosmetic effects, sometimes with the other problem, they want to compete with their peer group and they forget sometimes. So compliance is very, very important, that to take medicine regularly with time, on time.
That's very wonderful. So this have a associated question, sir, that what kind of medicines a kidney transplant patient has to take?
Okay. We call them as immunosuppressants, to suppress your immunity in a layman language. There are medications which they have to follow. We use 3 kinds of medications, steroids, and some CNI, some MMF, mycophenolate, the other class of drugs. And on that medication, the kidney works very good. Because anytime you keep place any kidney which does not belong to you, the body starts to reject it. So these are the medications which help them to keep the functioning of that transplant kidney. Second important is the doses. Once we transplant, initial 3 months the doses are high, then after 3 months dose reduced. After 1 year the doses reduce very much. So it becomes easier for the patient. The cost of treatment reduces, the chance of infection reduces, but they have to be taken lifelong. The important is that sometimes the patient asks that does the medication need to be taken lifelong or it is for the some time. Till the time we want the kidney to be functioning, it has to be lifelong.
Right. So, and these medicines are universal, worldwide, remain the same, these 3 categories?
There are certain more medications as per the patient profile or as per the patient need, we change them.
And we have those facilities in India?
Yes, in India, and the cost of treatment is also reduced because of the many brands coming, and we have the options available now.
Right.
So definitely it is affordable for any kind of patient. See, many times the government institute, they are providing the medication free of cost. So even the poor patient or the patient, economically weaker patient can also afford to have kidney transplant in those centers, and he can get the free medications. So his kidney will be as alive as a richer person.
We are really thankful for all your information about the kidney transplants. These are really beneficial for all the people who are interested in knowing for the kidney health. Thank you so much.
Thank you very much.